Drug overdoses tied to 24-fold rise in organ transplants. As the opioid epidemic has skyrocketed in the United States, a rise in the number of drug overdose deaths has contributed to a rise in organ transplants, made possible by overdose death donors, across the country. A study published in the journal Annals of Internal Medicine on Monday now reveals just how much of an increase there has been in the number of overdose death donors, from being only 1.1% of all donors in 2000 to 13.4% in 2017. The study suggests that a rise in organ donations from drug overdose deaths could help America's organ shortage, but it also shows that between 2000 and 2017, many organs from overdose death donors were not used to save lives when they could have been. Dr. David Klassen, Chief Medical Officer for the United Network for Organ Sharing, said in an email that he thought the new study was interesting and added insights into the effects of opioid epidemic-related deaths on organ donation, as well as the outcomes for transplant recipients. We at UNOS have witnessed the increase in the numbers of organ donors, especially over the past several years, resulting from the tragedy of the opioid crisis in the United States, said Klassen, who was not involved in the new study. The study importantly illustrates that recipient outcomes are similar to those obtained from donors who die from other causes. It also illustrates how the transplant system has successfully incorporated the use of organs from these donors into clinical practice, resulting in benefits to many patients, Klassen said. Underutilization of organs from these donors still occurs and is probably underestimated in this paper by looking at discard rates, since this does not account for organs that are never procured despite the possibility of providing benefit to potential recipients, he said. Dr. Camille Nelson-Cotton, Clinical Director of Transplant and Immunocompromised Post-Infectious Diseases at Massachusetts General Hospital, wrote an editorial accompanying the new study. The editorial calls for enhanced efforts to provide organs for patients most likely to have long-term benefit from transplantation. We need to save more lives of persons awaiting organ transplant, she wrote. The transplant community should understand these new data and forge ahead toward better transplant outcomes for more recipients.